today we're talking about options when it comes to contraception. So the perfect guest today is the director for the Olson Center for Women's Health and OBGYN, Dr. Sonja Kinney. Thank you for being here.
Well, thank you, and I hope we have a lot of watchers out there.
Yes, a lot of watchers. And if you have questions, remember you can comment below and we can address those live, or if they're sensitive topics and you'd like to send us a message, go ahead and do that during this discussion and we will get back to you. So don't feel like you have to type them in right away if you have a question that you think of later or you see after the live broadcast. And of course, we want to remind you this is a live chat for informational purposes only. So if you do have a question specific to your health or medical question, not just a general question, you want to direct that to a doctor. Thank you for being here today.
You're welcome. Let's get started.
Absolutely. So let's talk first about some of the factors that you want to take into consideration, because different women in different stages of their life and different types of health might have different options that work out better. So where should you get started?
Yeah. So a lot of times when I meet a patient for the first time, I'm going to get a sense of, you know, where they are in kind of with their reproductive plans. Maybe they're a teenager who is someone who says, I can't remember to take pills. At the same time, I'd feel very uncomfortable having a pelvic exam. So you kind of weigh some of those options to look at what might be something you'd offer them. Then we have patients that just had their third baby and are not really ready to say we're all done, but they are pretty much thinking they're done. So they want something very, very effective and something that's reversible, and they really don't mind that pelvic exam, and they're kind of at a phase of life where they really want to, they are able to do something because they're taking other pills. And then we have people in their perimenopausal years, and let's not forget that until the cycles stop, people really do have to have a contraceptive plan. So we have women in their 40s who are cycling but starting to have perimenopausal symptoms. And so I kind of combine what symptom relief they may want that can also come at the cost of getting birth control as well.
I think there's options that a lot of us are familiar with, things like the pill, but what options are there? How many options are there?
Lots and lots of options. And I think that it's important to know that around the world there's a lot of research going on into especially very interesting male contraceptive reversible options. We don't quite have those in the market here. But in general, we think of kind of the lower effectiveness are things over-the-counter barrier methods, condoms, the female condom, people still using the diaphragm. There are ones where we use a pill on a daily basis. That could be in the form of an oral pill. It can be a patch that people change every week, or even a vaginal ring that they wear for 3 to 4 weeks that takes that hormone in. We have our implantable devices, which is an intrauterine device, and there's a lot of different varieties there. Some generic, some with hormones, some without hormones. And then we have an implantable device that goes in the arm that is a progesterone only one for 3 to 5 years, depending on kind of the patient's age group. So lots of different options out there. I'm excited because over the 20 years I've been doing this, it's just we have a lot more to offer patients.
Well, and the thing is, it's not one size fits all. And I think in a lot of cases, people might just want to go to the drugstore. They don't want to have that embarrassing conversation with their doctor. Or they don't think necessarily about that.
Don't be embarrassed.
Go ahead. Yes, please.
I mean, on our kind of list of vital signs for an OBGYN clinic visit, and I should say many family medicine and internal medicine primary care providers, whether it's a nurse practitioner or a physician, they feel very comfortable talking about birth control because it's part of your health plan. It's one of the things we talk about, what's your blood pressure, what's your height and weight, are you a smoker, and what's your contraceptive plans? We ask it in that way.
Yeah.
It should not be something that it's an embarrassing topic. It does get a little dicey when people come in and they're younger patients. The Nebraska laws are that we can have patients come in to request counseling even if you're a minor. We can give prescriptions. We cannot do any procedure for a minor without the patient's parental involvement.
Sure. Now, so when you talk to a doctor, you might even find options that you didn't know existed, basically.
Right. And we'll have patients come in and they tell us, I want to have this type of contraception, and then we have to dig through what are the actual details of your life. What is your history? Really, what are your goals with contraception? And again, lots of women are going to have painful periods. And by giving them an IUD, which is excellent birth control, and they're good for 10 years with it, that will do nothing for their painful cycles. If people have heavy cycles, we have a way to combine our hormones with birth control to try to alleviate those. So I mean, that's why it's really important to come in and actually talk to someone who's getting the whole overall picture of your GYN health.
And Dr. Google is not going to get that. No. Speaking about options, there may be some women who are, I'm pregnant now, I know I'm done. This isn't, I'm not pregnant now. I'm saying some women out there might be saying.
We can talk later.
No.
You're young.
Might be saying, hey, I know that this is going to be my last pregnancy.
Right.
Is that something that can be taken care of if someone delivers here at Nebraska Medicine at the time?
Yeah. At this point, we are very proud to be able to offer women what we call it a postpartum tubal sterilization procedure. Obviously, the easiest time is when you're having a C-section, not an indication to have a C-section just because you want your tubes taken care of. We talk to people because we don't want patients to think of it as reversible. In this day and age, the standard of care is actually to remove the tubes, and you really can't reverse that. You certainly could bypass the tubes by having in vitro fertilization because you still have ovaries, you still have a healthy uterus, but we want our patients to be sure. So there are some women that come in and that first visit, they know no matter what. We do pose scenarios. What happens if your baby has an issue? What if they deliver very, very early? And we really want people to think about it because you don't have to have it done right afterwards. You can have it done as what we call an interval tubal, which means anytime 3 to 6 weeks postpartum or beyond, we can do this as an outpatient procedure. One of the things that I'm really proud of working here at Nebraska Medicine is that we really have this as an option for patients. We have a lot of transfers of care for obstetrical delivery late in the pregnancy when patients find out that when they're at a faith-based hospital that it's really hard to sometimes make sure that those patients understand that they really, within their tenets and principles, they do not allow providers to offer those services.
So it's one of those things that you should look into if you know that that's an option that you want early in your care, perhaps when you're choosing your doctor, when you're choosing the hospital where you want to deliver. Switching gears.
But we are also, if you're 36 weeks, just give us a call. We're happy to take care of you.
We'll take care of you at any point, and our labor and delivery department does outstanding work. You're willing to counsel on anything. You can help women get to understand their bodies in any way. So even when it comes to something like natural family planning, is that something that you and our doctors here can help with?
Right. So the principles about natural family planning really focus on a woman taking careful record and note about different symptoms, and it really only works when people have fairly regular cycles. We don't propose to patients that they use this as a primary goal, in that for most of our patients who truly want reliable birth control, it would not be put in that category. And it's not that people are doing the wrong thing. It's just very difficult. And when you have a patient who's trying to get pregnant, it's very difficult for them, even using medical technologies, to look for various hormones to really precisely see when they ovulate. So even if they're trying to find it, and if we're trying to find it to not try to get pregnant, it's difficult both ways.
It's used in both ways. And again, circumstances where it's best to consult with your doctor. You should be seeing them every year and asking those questions instead of just going to the internet, because this is a topic where you definitely don't want to just put your health in the hands of, the search bar, basically, so to speak, when you have experts like this. And you do specialize, and the team here specializes in finding contraception for people that may have complex situations. So people with some medical conditions may have been told there's nothing out there for you, it won't work for you. Is that true?
Yeah, we are especially concerned about our patients that have chronic diseases, diabetes, they're taking medications for seizure disorders. There are people who have they've had a clot before, a deep vein thrombosis, so they're on blood thinners. We would really like to have the opportunity to have a discussion with them. I think in most cases the patients may misinterpret you don't have options when really the person was saying, I don't think you're good for this and this, but there are certainly options out there. And so we really want people who have chronic medical diseases, they above everybody else should really be trying to plan out a pregnancy, because some people really will have better outcomes if their chronic disease process is really well managed. Even thyroid disease, when we have people coming in who just come to see me for a well woman visit and they say, I want to get pregnant this next year. I say, folic acid supplementation, let's check your thyroid, and then let's look to see, are you at a healthy BMI? What are some lifestyle things you can do? But we have some distinct things that we really do from a preconception counseling that can be helpful.
Well, and the Olson Center for Women's Health really focuses on the health of women in every stage of their lives. So from those early years and beyond, whether you're talking about looking at contraception options or like, we just discussed, if you're on the opposite side of things and you want to do the things that you can to help you get pregnant, Dr. Kinney and her staff can help you out. So anything else you'd like to add to the conversation today?
Yeah, I think one of the things is that a lot of people are worried also about cost of contraception. Definitely lots of employer plans have gone with the Affordable Care Act, conditions where a lot of the birth control is with zero out-of-pocket costs. We never want to quote to people what this is. We also have a very important Ryan grant that is run by Dr. Gina Mora here, one of my partners, who also works with early pregnancy assessment and complex contraception. And this is providing actual long-acting reversible contraception, which is very expensive if you don't have insurance. And we actually can provide that at no cost when patients meet criteria. So really important to look out into the community, whether it be Planned Parenthood, whether it be with us, different options out there. Don't think that just because it might cost a lot that you can't have access to it. And if you're trying a contraceptive method and you're having symptoms, a simple example is a person taking birth control pills. Let's say they start having headaches. Please just let us know you're having this issue. Don't put them aside and say, I'm not a candidate for anything else, because there's always a lot of other options.
So in a great place to find those options here at Nebraska Medicine. If you're looking for more information or want to schedule an appointment with a provider, you can go to nebraskamed.com. You can check out the Women's Services tab there, find out more information for the Olson Center for Women's Health, or call 1-800-922-0000. And of course, we'll be back next week with another Moments in Medicine Live. Thanks to you, Dr. Kinney.
You're welcome.
And again, if you have any other questions after this and you don't feel comfortable posting them in the comment section, you're more than welcome to message those. We'll talk to Dr. Kinney and get some answers for you. So thanks for watching, and we'll see you next week.